Good afternoon. My name is Andre Juno, and I've been a patient here back in April of 2011. And I came here for a knee injury. I injured my knee while playing hockey, ice hockey, and decided not to go with the traditional medicine and MRI and all that. I didn't go that route, and I knew Pieter from before, from our church actually, so I just contacted him and he was able to see me. But first thing that he did when he saw me, well, I tried to roll up my pants to show him my knee, and then he says, no, I don't need to see your knee, I just want to make some measurements. So he took a bunch of measurements and ended up telling me that my problem was my guts. My guts were too big. And then, you know, that sounds pretty harsh when you first find out about that, but then he's explaining to me what it does to the rest of my posture, into my my hip bone and my leg and all that, and the whole mechanics of it he explained, and what he made me understand is that because I was doing such a violent sport, that it demanded so much of my articulations and different parts of my bodies, that if my hip, for example, couldn't respond properly because it was busy trying to hold my guts, then my knee had to take the hit for the extra demand of the exercise that I had to do playing hockey. So anyway, a torn ligament came here, and then he obviously, the first thing with my guts, realizing that, is he told me, you know, I need to get off sugar, which was amazing. I mean, just eating whatever I can, but no sugar. I think I lost like 7 pounds in 1 week. It was unbelievable. And I never really thought of myself as having a weight problem. Like if you look at my BMI, I was probably at 25 back then. So, but still, I mean, I had that, you know, over 40-year-old gut. So helped me there with the weight. And then obviously he also gave me a bunch of stretching exercises, and also some holds or hand positioning in different parts of the body, which I didn't really think that made a lot of sense to me. I didn't really connect with that, and came back to see him, and I was good at, you know, doing the stretching and doing all that, but I didn't really see, you know, at first, a lot of improvements. And then he asked me, so what about the holds and the hand positioning? How are you doing with those exercises or this homework? I said, well, I think it's a little crazy. I'm not doing that, you know, very well. And he said, Andre, you gotta do it. Give it a chance. I mean, you know, I'm not asking you to believe in it. I'm just asking you to do it. And I said, all right, I'll do it. So I did that, and I could not believe. I seriously could not believe how it helped, and the improvement with my pain in my knee. And I can't even tell now. Actually, I'm holding this knee because this is the one that got injured, but I can't even tell which knee. I don't feel any pain anymore. It took you know, 3 months following this treatment for me to get out of this. Never saw a doctor, needed to, or MRI or anything. I feel like a new man, and this has been a real turning event in my life, especially as it pertains to diet and watching what you eat, especially you know, sugars. So I'm very grateful for what I learned, and I actually still use these techniques today, to this day, when I have some pains in some of my joints. I pretend to be you know, educated in this, and I try this, and somehow it helps, you know, those holds. So anyway, thanks, Peter, for all your help. I really appreciate it. And thank you for you and your team at CTS Physical Therapy. Thanks.